I'm going to do a very brief update about the Institute. So I head up the Institute. And here's the Institute team, some of whom you may have had emails before from, and now here is a face to the name. And most of them are here today. I'm very happy to help, but also they're really happy to help you during the year. I wanted to start by just reflecting. So the Institute was launched in 2015, which is just over 4 years ago. And I just first wanted to congratulate you all on the amazing amount of things that have happened since then. So the way I've done it, I thought, right, in 2015 we were talking about costs. But now the conversation is more about costs and outcomes, and it's about thinking how can we link costs and outcomes to drive value. If we go back to 2015, it was mainly a conversation with finance, and all our events would be mainly finance staff. But if we move forward to now, it's much more conversations between finance and clinicians. And at our value events, we usually have about 50% clinicians and 50% finance in the room. And that makes such a difference to the conversation. Again, going back to 2015, the focus was very much about costing within the trust. And now the conversations are starting about, okay, how do we map costs across the ICS, the STP, the healthcare system? And finally, again, the focus very much in 2015 was on the standards and how you cost. And what we're now talking about much more, or you are talking more about, is about, right, we've got some cost data. How can we use that cost data to support improvements within our organisation or our health economy? And what's great in our 5th year, just starting the 5th year of the Institute, is that the President has chosen the theme of value as his theme for the year. So that's really exciting. We recognise that you and your organisations are all at different places on the costing and value journey. And so what we do is we build our themes around those stages of the journey. There will be some people in the room here today who are very much focused still on thinking how to cost and are concerned that perhaps their data and processes aren't yet where they need to be. And so for those people, our first theme is around confident costing and helping you to improve your costing. There will be people who have implemented PLIX and they've got loads of data, and I hear this often, we think, right, we've got loads of data, what do we do with this data? How do we turn this into information? And so our second theme is around translating data, how you turn your patient level costing data into information. Having got your cost data, then clearly the next thing is to think, how do we use that to drive value-based healthcare? And our third theme is around driving value and about improving patient outcomes at the lowest possible cost. And then there will be a handful of you in the room who are actually way ahead and want to be at the cutting edge of costing and value. And that's why our fourth theme is around innovation. So just to give you an idea about what we do under first three themes, so confident costing, clearly you're all here today, so you're at the costing conference, but we have a range of costing events during the year, and I'm hoping that some of you will come to some of those events during each year. And I think a big thing that we get the feedback from is how much you value the networking opportunity. I appreciate that a lot of you are quite isolated in your individual organisations, and these events give you the chance to find like-minded people, have a bit of a moan, but also kind of have a bit of a morale boost about what you're trying to do. In terms of the translating data, as I say, you've got loads of information, and the challenge is how to make the most of it. And so we have a range of publications and products and workshops. And I suppose just worth thinking, isn't it? I mean, we all know that PLIX is so useful for supporting efficiency improvements and improvements in patient care. And I think it's a really big thing about thinking how it can support your clinical teams to do what they're already trying to do. So it's not like this PLIX is over here and all that clinicians are over here. They have service redesign, they have GIRF, they're looking possibly at model hospital. PLIX can really support all those initiatives. And if you go to the Institute stand in one of the breaks, you can find some more information about our case studies and value challenge projects. And then value, which I think everyone would agree value is a very good idea, but translating a theory of value into practice is not easy, and therefore our events and our case studies and our challenges are very focused on the practical things to make that happen. So really pleased today to be launching the programme for 2019-20, and I think there are copies of it on your tables to take away. One thing to note that we're doing slightly differently this year, was a new initiative, is that so last year we published a briefing on costing skills in the NHS. And what it highlighted is the challenges you're facing, which I think you all nod at this point, that in terms of capacity, having enough people with the right skills to cost, but also to support people within your organisations to use the cost data. And it is a massive challenge, and there's no more money to go and buy more people. That's just not a reality. So what we're trying to do is to support you by promoting PLIX to other colleagues within your organisation who we think have got a role to play. And as a start, we produced some small briefings, which you can take away today. They're on the Institute stand, for people like finance business partners, or informatics, or clinicians, or management accounts, to get them starting to be interested in finding out more about what PLIX is. And this is just the sort of early start on this, and there'll be more things coming out over the next few months, so watch out for that. Right, so to end, and to get onto the proper conference, the main thing is congratulations to you all on the progress you have made since 2015, and we're really looking forward to supporting you over the next year. Okay, that's me done.